Dr. Richard Buckley, MilfordMD, with our team. Today's project was breast augmentation, 425 cc natural Inspira implants, which are full in size. They're smooth. We don't use textured anymore. We almost never did, but the world doesn't use them anymore. So smooth, round, and full. It means they have a whole lot of forward projection. So, the base size of implants needs to fit breasts. So however wide the breasts are, we should come in just a little bit, and that's the foundation size of the implant. What is more a choice then is how much forward projection one is interested in. It can be a little bit, moderate amount, can be a lot. So today we're doing a lot per our patient who tried on some sizing implants before today's procedure. She's also awake the whole time today. Are you awake?
I'm awake.
But you fell asleep?
A little bit. Here and there.
Yeah. And it's totally comfortable?
Totally comfortable.
All right.
Yeah.
Amazing. And so the work is in, and we have some little nipple obscurers because I guess the Puritans in America don't like it if, nipples are shown online. And so they have Band-Aids, and in any case, we do put at least something over the areola, that's the pigmented part around the nipple, all the time with breast procedures in order to seal them off, because the areolas have little ducts, and the ducts have bacteria in them. We're not interested in sharing bacteria on our sterile field that we create. In this case, I also put little round Band-Aids there. Geez, I'll even cover them up like that. So I think we're good, yeah? But in guys, it doesn't matter. You can show guy nipples and breasts, that's okay, right?
Yep.
Even though they're huge and bigger than some of our women. That's crazy. There's a Keller funnel. There's an implant in here. I always want to make sure that the downside is down in this little gadget, which helps with putting the implant in. I can put the implant in without this, but this is just so much nicer. So we did, about an hour's worth of work on each breast, making the pocket and getting it the way we wanted to. Made a tiny little incision at the bottom of the breast in what's called the inferior mammary fold, or IMF for short. Not to be confused with the International Monetary Fund. To be careful with the word salad, letters. And so anyway, I put this little Keller funnel there, put the implant there, and I go whoosh, and you can see this breast is now bigger than that breast. Whoa, that's nice. So, how long did that take?
5 seconds?
No, it wasn't that long. You have to time the video. I'll bet that's 2 seconds flat, right? So the actual putting in of the implant doesn't take very much time. I will sew this bottom closed. Stitches will be under the skin. Our patient will be happy and good to go at the end of the procedure. She's wide awake now. She'll still be wide awake. She'll jump up off the table and be good to go. Today we happen to put them sub-mammary, which means we put the implants where the breasts are. The breasts are on top of the muscle, so we put the implants on top of the muscle, which I think in general is probably a great place to put them. You start putting them under the muscle and then they move funny, and there are all kinds of issues. And who might want that? Somebody who's really skinny and doesn't have so-called very much skin envelope up here on the top. And those are exactly the people where you're going to see some strange movements, and some personal trainers, people are really athletic. It's probably not a good idea to put things under the muscle for those people. So I don't know when a good time is for under the muscle, but these are under the gland on top of the muscle today. Sometimes we put them in an in-between plane. There's kind of a whitish bit of tissue around the pectoralis muscle. It's fascia, it's called, and I can actually lift that fascia up a little bit and slide the implant between the muscle and the fascia, and then the breast is on top of that. So it's a subfascial breast augmentation. And so sometimes we do that. So might as well use up a little more time. They come like this, and then we make a modified atom solution, and try hard not to touch the implants with my hand. we just, and I've changed gloves since I began the procedure, so just before doing anything with the implants. And we, kind of re-scrubbed things and made things ultra sterile. So I'll put a little fluid in my pastry funnel here. And, we always order 3 implants for each patient, just in case there would be some kind of issue with one. There never has been, so the company allows us to take 3 and just return the one we don't use. So, all right, here's the funnel. Here's side number 2, and I'm putting the funnel there. There's the implant, and now it's in. Now things are equal. So now I just need to sew them up on the bottom, which just take a little time, not much. We'll be done. So it's as easy as that. Wide awake patient. Yep, comfortable, totally.
Very comfortable.
You have bigger breasts now.
I know.
You'll be amazed. All right, guys, thank you for watching Dr. Richard Buckley and team at Milford MD.